Have you had knee surgery recently? An ACL reconstruction? Maybe a knee replacement? And in either case, are you having some trouble getting your knee straightening or knee extension back? If so, this program is for you. Regaining knee extension is super important after any knee surgery. It's especially important after an ACL reconstruction. So to put that in perspective, ideally patients regain full knee extension as compared to their opposite side by about 1 to 2 weeks post-op. Sometimes patients don't meet that goal. Sometimes they struggle with getting back their knee extension, their knee straightening. And when that happens, this is the program I like to use. First thing we're going to do, foam rolling. What we're really trying to do is loosen muscles in the calf and hamstring, which might restrict knee straightening. So real simple, we just put the thick part of the calf on the foam roll, lift up our body weight so we're just on our other foot and hands, and roll around until you find a knot in the calf. Oh, there's one. And then just let the weight of the leg settle on that spot. Honestly, it doesn't feel great. And as you sit there for a moment, the knot dissipates. Look for another one. Roll up a little bit. Oh, there's another one. And just let it sit for a moment. Then you might turn inward. Same thing. Oop, there's a knot. And all you're doing is gradually working from the calf to the back of the knee into the hamstrings in the thigh, looking for little knots and trying to basically massage them out. So it takes about a total of 2, maybe 3 minutes. Okay, the next stretch, we're going to stretch the calf muscles out that we just got done foam rolling. So you'll want something for stability. In this case, I'm using my foam roll. You could just have your hands on the wall, on the countertop. So here's my hurt leg. So hurt leg is back, foot is flat, knee is straight, and my toes are pointing forward, at least relative to me. They're not out this way. Also, you'll want shoes on for this. We want some arch support, so more of the stretch goes into the calf rather than into the foot and the arch. So you're simply going to lunge forward on a straight knee. You should feel pulling in the calf, maybe behind the knee. Hold for a solid 30 seconds. We're going to do this 3 times, 30 seconds. Give a short break by straightening the front knee, second or 2, then repeat 30 seconds. Before I start the next exercise, I want to remind everybody, if my content's helpful for you, click those like buttons, click those subscribe buttons, leave a comment. I'd really appreciate it. Next thing we're going to do is stretch the hamstring muscles, the muscles behind the knee. If they're tight, they'll limit knee extension. So we got done foam rolling the hamstrings just a few minutes ago. We kind of prepped the hamstrings to be stretched. Now we're going to stretch them. Now, if your surgeon used part of your hamstrings to reconstruct your ACL, you can't do this right away. Somewhere around 3 to 4 weeks post-op, we can start stretching hamstrings a little more aggressively. Certainly work with your physical therapist on that. So here's how you do the stretch. I call this the split stance hamstring stretch. Standing upright, both knees straight, the back leg, the non-hurt leg, is turned out a bit. And I'm simply going to bend forward toward my front ankle. I'm reaching for my front ankle with both hands. If this is a little too much of a stretch for you, you can rest your hands on your leg to support yourself a bit. Otherwise, let gravity do the work. You should feel pull behind the knee. Hold this for 30 seconds. Then give it a little break. Just bend the knee, support your weight on your knee for a second or 2. Return to the stretch. 30 seconds, 3 times. Our last stretch is a heel prop knee extension stretch. So my hurt knee is my left knee. I simply prop it up on a chair, the coffee table, something like that. And I'm going to clench my thigh muscle, my quadriceps. And when I do that, it straightens my knee a bit. Hold for 10 seconds, then relax. Do this 10 times. So for my patients who are a little behind schedule after surgery, whether it's again an ACL reconstruction, maybe a knee replacement, in any case, if they're a little bit behind schedule, we want to get a little more aggressive with knee extension, I'll advise them to do this once an hour. Press down, hold 10 seconds, 10 times, once an hour. Now, in addition to that, 2, maybe 3 times per day, I'll have them do a static stretch or just let the knee hang in this position. pretty much as long as you can, up to about 30 minutes. So for example, my college student patients who've had an ACL reconstruction, I'll say, hey, when you're in class, prop this heel up, let it hang. If you're back at your dorm room, your apartment, same thing. In addition, take a hot pack when you can, hang it over the knee. This does a couple things. Number one, the hot pack's a little bit soothing, allows you to tolerate a little longer stretch. It heats the tissue, it makes it a little more stretchable, and it adds some weight. So again, as long as you can do this, 15 to 30 minutes would be ideal. Just let it hang, try to relax, let it straighten. That's my post-op knee extension program. And again, this is really for that patient who's recently had an ACL reconstruction, maybe a knee replacement or some other knee surgery, and is struggling to regain their knee extension range of motion. I hope you found this video helpful. Click those like and subscribe buttons, and we'll see you in the next video.